Hello, everyone. Let's start our revision. Hello, everyone. Today, we will continue our schedule of the revision with the third revision session, the recent recalls for KAPS exam. As usual, we will discuss many of the questions or many of the recalls from previous exams, which help us to solve the questions in the exam. We will discuss about 15 questions. I will make all of you mute. Then if you have any question at any time, please raise your hand and start to ask. And at the end of our session, I will open the discussion for all of you to ask about anything you want related to the KAPS exam. Okay? Let's start with the first question today. The first question here. What is the first line therapy for Lyme disease? Here we have two questions regarding to Lyme disease. First question, what is the causative organism? And what is the treatment? The causative organism is Borrelia burgdorferi. It is the causative organism for Lyme disease. Here we have a question asking about this point. Okay, so which of those drugs is the drug of choice for this Lyme disease? Ciprofloxacin, azithromycin, clarithromycin, doxycycline, or gentamicin. Here we didn't saw any penicillin present here. So the best choice from those choice will be doxycycline, tetracycline, or any of the tetracycline is the drug of choice for this Lyme disease. The next question. Filgrastim is used too. Please pay your attention for this question because it have a tricky point. We have a trick in this question. What is this trick? Let us see. Filgrastim. Firstly, what is the filgrastim? Filgrastim, one of the colony stimulating factors, which stimulate the production or synthesis of white blood cells, especially neutrophils. Okay, especially neutrophils, white blood cells, especially neutrophils. So let us see the choices and understand the question. It will reduce the risk of urinary tract infection, or reduce the risk of peripheral neuropathy, or reduce the risk of the cardiotoxicity, or reduce the risk of hemorrhagic cystitis. Which one is the right one? Here, to understand the problem here with low number of white blood cells or immunity, which leads to the opportunity for infections. So any infectious disease can be protected by the use of filgrastim, but not for all patients. For patients who are having bone marrow depression or taking chemotherapy or taking immunosuppressant agents. Okay, so the best answer for this is A. It will reduce the risk of urinary tract infection to protect against urinary tract infection or any other infections. Okay. Which of the following cytochrome enzyme action is incorrect? Here we are looking for the incorrect match. Please take care about this. Smoking is cytochrome 1A2 inducer. Is it right or wrong? For sure, it is right. You should remember this very well. So this is a right statement. Tamoxifen is a cytochrome 2D6 substrate. Is it right or wrong? Also, this is a right one. Which other drug, or can you give me an example of other drug that is substrate to cytochrome 2D6? It is codeine. Yes, this codeine, one of the substrate of cytochrome 2D6. Another drug, can you remember another drug? Bupropion is an inducer to cytochrome 2D6. It's not a substrate. SSRI. Dextromethorphan. Yes. That's good. Clopidogrel is a substrate of cytochrome 2C19. Also, it is a right statement. St. John's wort is the cytochrome 3A4 inducer. It is a right statement. A right statement. Clarithromycin is a substrate to cytochrome 3A4. No, it is not a substrate. It is inhibitor. It is inhibitor. So the right answer here is number E. The next question. Arrange the higher elemental iron to low elemental iron supplement. From higher to lower. We have many salts of iron here. Ferrous fumarate, dried ferrous sulfate, ferrous sulfate, ferrous gluconate. So what is the right order from the higher to lower? The highest one is fumarate, which contain about 33% of elemental iron. 33% of it is an elemental iron. So here we have the first choice is the right choice here. Ferrous fumarate, then dried ferrous sulfate, then the least one or the lowest one is the gluconate. The next one, it is a calculation problem. A 3-year-old boy diagnosed having otitis media has been prescribed amoxicillin suspension at a dose of 90 milligram per kg for 5 days. His weight is 36 pounds. If the product in the pharmacy is 250 milligrams per milliliter and the doctor instructed to give it in 3 divided doses, how many milliliter is the total volume required? Here we want to calculate the total volume this child needs for the 5 days. What is the first step? It is calculating the total dose, total milligrams that he will receive. Okay. To calculate it, we should multiply the dose, 90 milligram, by his weight. What is the weight? 36 pounds. So 36 pounds over 2.2 to convert it into kilogram. What is the result here? 36 over 2.2 equal 16.36 kilogram. So this is the dose, 90 by 16.36 equal 1,472.72 milligram daily. Okay. The bottle of the amoxicillin contained 250 milligram each 5 ml. So what is the total daily dose and what is the total what total volume he will receive? The total milligrams he will receive is 1,472. How many milliliters? We just make a crisscross. You will get 150 milliliter of this bottle. Okay. Another calculation problem. Griseofulvine 50 gram added to glycerin 20 milliliter. Okay, to form a paste. The density of glycerin is 1.25. What is the unit of this glycerin? 1.25 gram per milliliter. This is the unit of the density. Okay. The final concentration of griseofulvine in the paste is, what is the final concentration in this case? Okay. We should know the weight of glycerin, this 20 milliliter, corresponding to what? Or how many grams? So every 1.25 gram present in 1 milliliter. So the 20 milliliter containing how many grams? You should multiply 20 by 1.25 equal 25 grams. So that the 50 gram of griseofulvine present in the solvent here is 25 grams of glycerin. How many grams of griseofulvine present in 100 gram of glycerin to give or to have the percentage weight per weight? Okay, so 100 multiplied by 50 divided by 25 will be 200 grams. Okay, but here we did a mistake. What is this mistake? The mistake here, the 50 grams of griseofulvine plus glycerin 25 grams, all of them will form the solution. So it should be 57. The total weight of the paste is 57 grams. So this 50 grams present in 57 grams of total paste. Okay, so let's do the calculation again. 100 multiplied by 50 over 75 equal 66.67 weight or per weight, percentage weight per weight. Okay, is it clear? Please take care about this point. I intend to do this mistake to show you the mistake that we can fall in. I'm sorry. Here, the 50 gram of griseofulvine present in the total weight of the paste, which is the 50 gram plus the amount of glycerin. This is the solution. Another one. To prepare a solution of 25 millimoles per liter of sodium chloride, how many grams of sodium chloride should be used for 1 liter solution? Okay, it's a very easy question. Here we have the concentration, 25 millimoles per liter. And he asked about the weight by grams. Number of millimoles equal the weight over the molecular weight, but the weight here by milligrams. Okay, so 25 millimoles multiplied by the molecular weight when you transfer it to the other side. So multiplied by 58.5 to get the weight of the sodium chloride that's present in 1 liter per milligram. Please take care about this. So 25 multiplied by 58.5 equal 1,462.5 what? Milligrams. And the answer should be by grams. So you should divide this by 1,000 to get 1.46. Okay. In the chat, I have a question about one of the calculation problems that we discussed. Marwa asked about to repeat again. Which one? This question number 7 or question number 6? Number 6. Okay. So let's go back to number 6. Here he mentioned that the griseofulvine added to glycerin. We add an amount of griseofulvine to another amount of glycerin. Okay, both added together to get the final mixture or the final paste. Okay, an amount of griseofulvine which is 50 grams added to certain amount of glycerin which is 20 milliliters. But here we need the concentration by weight per weight. So we should know the weight of glycerin corresponding to this 20 milliliters. Okay. How can we know that? By using the formula of the density. The density of glycerin is 1.25 gram per milliliter. Each 1.25 gram equivalent to 1 milliliter. So 20 milliliter equivalent to how many grams? It is 25 grams. Therefore, we add 50 grams of griseofulvine to 25 grams of glycerin. The final volume of the paste is 50 plus 25, 75 grams. Okay? So that to know the concentration of griseofulvine in this paste, we have 50 grams of griseofulvine present in 75 grams of the paste, the total solution. What is the percentage in this case? The 100 grams contain how many grams of griseofulvine? It will be 66.7%. Is it clear? Marwa, please confirm. Okay, thank you. The question number 8. What would be the loading dose? Here he asked about the loading dose. So here we are dealing with a pharmacokinetic calculation problem. What is the loading dose of drug if desired peak concentration is 20 microgram per milliliter, steady state plasma concentration. If the apparent volume of distribution is 4.5 liter. As usual, as I mentioned previously, for any pharmacokinetic calculation problems, we need two things. First thing is the formula that we use. Second thing is the unit of components of this formula. They should be similar units of each parameter. The weight should be with similar units. The volume and also the time should be with similar units. Let us see the formula firstly. What is the formula needed here? Loading dose equal plasma concentration multiplied by volume of distribution. So you should multiply this value by this value. But can you multiply 20 by 4.5 directly? It will be wrong. Why? Because here we have different units. The unit of weight is microgram, but the unit of dose that needed by milligram. So we should convert this microgram into milligram. How can we do that? From milligram to microgram, you should divide by 1000. So it is 20 multiplied by 10 to the power minus 3. Okay? This milligram per milliliter. The unit of volume here by milliliter and here by liter. So you should multiply this by 1000. It would be 4.5 multiplied by 10 to the power 3 to be by milliliter. Okay? You should do that even if we cancel or neglect this by this. But we should do that. Sometimes in some other questions, the units will be different and therefore you cannot multiply directly. So that here, 20 multiplied by 10 to the power minus 3 multiplied by 4.5 by 10 to the power 3. This will go with this, so that 20 by 4.5 will be 90 milligrams. Okay? The next one. Which of the following all close contacts should be treated? All close contacts should be treated. This means that when a person in the community affected by this disease, all close contacts should be treated with the same treatment for the infected person. Head lice. Is it right or not? All close contacts should be treated or not? No. In the head lice, all close contacts should be examined. This will be the right statement for these head lice. And only the infected persons should be treated. Not only that, all the persons who shared the items with the infected person should be treated. So if we have a person, close contact to the person who having head lice, but not sharing items and not having the infection, it's not must to be treated. Okay? Scabies. All close contact should be treated. Yes. Even they have no infection. So this one is right. Let us see the other, because it is not the final answer here. Head lice and scabies. No, because head lice is not involved. Head lice and pinworm. Yes, in this case, both of them. Pinworm also. If any person infected by pinworm, all close contact should be treated. So that the right answer here is D. Please take care. Most of the answers coming is B, but it is not the right answer. Even B is right, scabies is right, but also pinworm is right. So the right answer here is D. Okay? Which of the following is not correct match? Matching between the case and the disease. Hyperparathyroidism will cause hypocalcemia, or hypoparathyroidism cause hypocalcemia, or hypoparathyroidism cause hyperphosphatemia, or hyperparathyroidism cause hypercalcemia, or hyperparathyroidism parathyroidism cause deficiency of calcium, which is not correct. So we should study each statement and see is it right or wrong. What is the relation between parathyroid hormone and calcium? If parathyroid hormone increase, calcium will increase. If parathyroid hormone decrease, calcium will decrease. Okay? So, hypoparathyroidism cause hypocalcemia. Is it right or wrong? Yes, it is a right statement. Hypoparathyroidism cause hyperphosphatemia. Is it right or wrong? Let us see. The hypoparathyroidism will lead to decrease in calcium level, which leads to increase in phosphate level. So that this is a right statement also. Hyperparathyroidism cause hypercalcemia. Yes, also. Parathyroid hormone increase. It's like the action of vitamin D. Same action of vitamin D will increase calcium level in the blood. Hyperparathyroidism cause deficiency of calcium. This is the wrong statement, which is the right answer. Okay? What is the drug of choice for KAP? What is the KAP? KAP is community-acquired pneumonia. In a patient has a penicillin allergy. Penicillin is the drug of choice for community-acquired pneumonia, the amoxicillin plus clavulanic acid is the drug of choice. But if the patient having an allergy of penicillin, so he should not take ampicillin or amoxicillin. Also, some beta-lactam antibiotics have cross-sensitivity with the amoxicillin, like ceftriaxone, so he cannot use ceftriaxone due to the allergy. The second choice will be doxycycline. Doxycycline is the right answer for this question. Another recent question, repeated many times previously in the last exams. Usually used as a diagnostic test in TB. In what? In active TB. Let us please take care about this word. It will direct us to a certain choice in this. Tuberculin Mantox test, chest X-ray, TB blood test, or TB skin test. Okay, we should differentiate between active and latent TB. Okay, the latent TB means that the TB is present but not active. It's not a must to be active. While active TB is present, we have two tests that give us an evidence that the TB is active. The chest X-ray and sputum, TB present in sputum. This will inform us that the TB is active. While other tests like tuberculin Mantox test is the TB skin test, both are the same. TB blood test, both of them will give us that the TB antigen is found, but it is not must to be active. Okay, so that the right answer here will be chest X-ray. Chest X-ray. Another question. The rebound action, such as runny nose and salivation, are most likely to happen as withdrawal symptoms from which drug? This means that if you stop this drug suddenly, you will have a withdrawal symptoms. Those withdrawal symptoms like the rebound action of anticholinergics. the rebound of anticholinergics. Anticholinergics doing what? Doing dryness of the mouth, dry mouth, and dry of the nose. Okay, so that when runny nose and salivation, here we have an opposite effect of anticholinergics. Therefore, he asked here about which of the following have anticholinergic side effects or action. It is tricyclic antidepressant. So the withdrawal symptoms of all of those are antidepressant agents or drugs with different groups: SSRI, tricyclic antidepressant, SNRI, or MAO inhibitors. Generally, when you stop the antidepressant, suddenly you will get a withdrawal symptoms. For those types, serotonin or SSRI and SNRI, you'll get serotonin withdrawal symptoms. For the tricyclic antidepressant, you will get some actions or withdrawal symptoms opposite to the anticholinergic effect of the tricyclic antidepressant. Okay? So we should not stop any antidepressant suddenly. Which of the following is the exception? Fluoxetine, paroxetine, sertraline, or venlafaxine? Which have the exception here? Fluoxetine. Why fluoxetine? Because it have the longer T half. The longer T half, about 5 weeks. Okay. Yes, this make fluoxetine not causing the withdrawal symptoms. The next question. Which is not correct about vasopressin? What is the vasopressin? Vasopressin is a hormone secreted from which part of the pituitary? Posterior pituitary gland. Okay, from posterior pituitary. Its action as anti-diuretic hormone. It will prevent the diuresis and it will make water reabsorption, increase water reabsorption and decrease its content in the urine. So the deficiency of it will lead to diabetes insipidus. Okay. Vasopressin having an effect on V1 and V2 receptors. V1 in the vessels, V2 in the kidney. V1, its effect will lead to some vasoconstrictor effect. So it will constrict the blood vessels. Increase the water reabsorption. This is the action of it. Okay. So that the wrong answer or the wrong statement here is action enhanced by alcohol. It was not affected by alcohol. The last question today. Not a symptom of hyperthyroidism. Not a symptom of hyperthyroidism. The function of thyroid hormone is catabolic function. It will increase the metabolism, increase the activity of the body organs. So you will find tachycardia with it, increasing palpitation. You will find tremors. Okay. So what is the exception in those? Yes, decrease appetite. It is not a function of thyroid hormone, even if the patient who having a hyperthyroidism, he have a weight loss, but it is not related to the decreasing of appetite, but related to the increasing of the metabolism. So destruction of the fats in the body, leading to weight loss. Okay. Those are all questions of this lecture. Now it's time for you. I'll open the discussion, so if you have any question, please ask about it and we will discuss. Do you have any question? No one? Everything is good. Okay. Yes, please. Ask about it. The causative organism of Lyme disease is called Borrelia burgdorferi. Borrelia burgdorferi. It is the causative organism for Lyme disease. It is a repeated question in the exam, so you should know it very well. Another question, which antiemetic is not safe in pregnancy? This question depends on the choices. Depends on the choices. So we have some evidence of metoclopramide should not be used, and some textbooks saying that it can be used according to the case. Also, promethazine, because its effect on the dopamine level. So here we have many choices according to the question itself. Yes. Another one from Ahmad. I saw a lot of complicated problems in APEC. Do we get same type of complicated question, or it's much easier? Don't worry about that. It will be much more easier in the exam. They know that you have a limited time for calculation, so they will not put a complicated questions that will take a time. Even some questions having a long introduction, but they can be solved within one step or maximum 2 steps. So don't worry about that. You solve the APEC problems to practice. This will help you to practice. But actually in the exam, you will find a more easier questions. We will study, or we will discuss most of the questions of the exam in our revision. So you'll find in our revision either those free ones or the paid one. You will see some questions of the exam from the real exam. Another question from Ronsk. Can you please tell the iron concentration of ferrous products? It depends on the formula itself. So you'll find that ferrous fumarate about 30 to 33%. Ferrous gluconate about 12%. The ferrous sulfate less than ferrous fumarate, about 28%. For whooping cough, the causative organism is pertussis. Bordetella, it's called Bordetella pertussis. Okay. Bordetella pertussis is a gram-negative organism. Carbamazepine or lamotrigine, which is safe in pregnancy. Lamotrigine is more safer. Lamotrigine is the safe drug in pregnancy. Molecular weight given in calculation, yes, the molecular weight will be given. Don't worry about that. We will not memorize molecular weight. You should not memorize molecular weight. It will be given. Do we use haloperidol in bipolar disorder? Yes. Haloperidol in manic episodes. Okay, so in comparison between antipsychotics and antidepressants, which is preferred in bipolar, antipsychotics or antidepressant? Here, the antipsychotic is preferred. Antipsychotics are preferred. All antipsychotics can be used, especially haloperidol, and that atypical antipsychotics except one of them. Which one? Clozapine is not used in bipolar. So we can use the other atypical, olanzapine, quetiapine, risperidone, ziprasidone, aripiprazole, all of them can be used. Plus haloperidol in the severe manic episode. Okay. After that, we can use the antidepressant, but we should take care. We should use them with caution. Why? Because it may convert the depression into the mania. The case will be converted into the other episode, the other pole. Okay, so here, if we have the choices of haloperidol and SSRI, which is not used, so that SSRI is not used in comparison to haloperidol. For pharmaceutical calculation, you can depend on our course of pharmaceutical calculation, which involved all calculation problems that you need, all practice that you need for solvation of the exam. Okay, so you can go to our website, www.newptech.com, and looking for the courses, you will find pharmaceutical calculation problems or pharmaceutical calculation course. You can depend on it in preparation for calculation. Do we get load of questions related to structure of drugs? No. The structures, according to the models or previous models, mostly you will not have more than 2 structures, okay, per exam. So don't worry about the structure, but you should know them very well, because they have a very important weight in the result, in the calculating of the score. Which drug structure we should practice? There is no specific structure. It's difficult to define a specific structure. Some structures repeated, but sometimes giving a new structures. So we cannot define a specific structure to study it. Just knowing the way to understand or to identify the structure by follow the following steps. Firstly, identification of the nucleus. Identification of the nucleus will help you to identify the drug group. So make connection between the nucleus and drug group. In this case, you can identify the structure, or you can identify what is this structure. Okay. Many questions here. Yes, I answered this previously. Molecular weight and atomic weight given in the exam. Don't worry about that. The pregnancy and carbamazepine and lamotrigine, we answered this previously. Lamotrigine is safer in pregnancy. Are there any tips for pharmaceutical preparations? No specific tips. Also in the revision, we mentioned the questions repeated. If the drug has more than one nucleus, what will we do? Yes, it's a good question. Some drugs or some structures defined by more than one nucleus, like the PPIs. And ARBs. Okay, when we studied those drugs, we mentioned the nucleus that present. It should contain many nucleus. If one of them not present, it will not be the drug. So they defined by the all nucleus. Okay, like ARBs, for example, formed of biphenyl ring. If you found biphenyl ring, mostly it will be ARBs, but it also should contain, or some of them contain, imidazole ring, plus tetrazole ring. It contains 3 nucleus. Okay, and the presence of the 3 nucleus are characteristic part of ARBs. Doxycycline as a tetracycline with milk have an interaction. So it may lead to chelation of calcium present in milk and leads to decrease in absorption of the doxycycline. Clozapine is the only atypical antipsychotics that not used in bipolar, have no role in bipolar. Okay, there is no clear reason about that, but it is the only atypical antipsychotics that have no role in bipolar disorders. Which drug causes nausea, cetirizine or prochlorperazine? I think prochlorperazine, this drug may leads to, I'm sorry, may not leads to this nausea. For the question, which drug against nausea is not used in pregnancy? This question, according to the choices that present, pyridoxine, diphenhydramine, metoclopramide, prochlorperazine, the least one here is the prochlorperazine. So if the choices are those, please choose number D, prochlorperazine. Okay. About doxycycline and minocycline, or the tetracyclines and the interaction with the milk. All of them will interact with calcium, but the least one, if you arrange them, doxycycline is the least. Okay, but still have some interactions. So if you compare between other tetracyclines, you can choose it. If you have a comparison, or if a question asking about a comparison between tetracyclines in their interaction with milk, which is the least, so doxycycline. Okay. I think there are no other questions. Finally, I'd like to thank you so much about your attendance today. I hope it was useful lecture for all of you. And for the full revision, please visit our website, www.newptech.com. Still, we have another 2 free revision lectures before our exam. The coming one and the last one will be in the next week. Okay, thank you so much, and see you in the coming revision lecture. Goodbye.
Thank you.
Thank you so much, sir.
Thank you.